Welcome to the deep dive. Our mission, as always, is pretty straightforward. We take complex source material, cut through all the noise, and give you the core insights. Basically, help you get quickly up to speed. Today, we're tackling a really essential tool, something anyone trying to connect resources to results needs: the logic model. We're leaning heavily on the Kellogg Foundation's work here. They've really set the standard for using this to bring planning, evaluation, and action together.
It really is foundational. And honestly, it exists because so many programs, well, they stumble right at the start. They want to help, sure, but figuring out the exact path, how to measure if they're actually getting somewhere, that's tough. You know that great Yogi Berra quote, if you don't know where you're going, how are you going to know when you get there? A logic model tackles exactly that. It forces you systematically to be clear about the destination before you even think about starting the journey.
Clarity is definitely the name of the game here. The formal definition calls the logic model a systematic and visual way to present and share your understanding. Basically how resources, activities, and results all link up. You could boil it down maybe to just a picture of how your organization does its work, or maybe, a bit more formally, the program theory.
Exactly. It's that map.
Okay, so let's start with the basics then. Unpack those 5 essential components of a standard logic model. The simplest version just links your planned work to your intended results. What are those basic building blocks?
Right. We'll lay them out in order, but the real magic is how they connect, that sort of if-then logic weaving through them. So first up, you have your resources, or sometimes called inputs.
Yeah.
These are all the things you start with: your people, your money, organizational assets, community connections, everything you have available. If you have these resources, then you can move to the next step. Activities.
Activities, that sounds like what you actually do, right? With the money, the staff, the building space, the processes, training sessions, events, the stuff the program actually undertakes.
That's it, exactly. The actions. Now, if you carry out those activities, then you get to the next stage, outputs. And this is interesting because, honestly, a lot of programs kind of stop here in terms of tracking.
The outputs, okay. What are those exactly? Are they just like basic metrics, number of meetings held, flyers distributed, that sort of thing?
Yes, precisely. They're the direct countable products of your activities. Think size and scope. How many people attended, how many sessions were run.
So it sounds a bit like administrative tracking,
Right.
Not really about the change you're trying to make.
That's a really important distinction.
Yeah.
It is partly tracking, and it's necessary. Outputs tell you if you actually did what you planned to do. You need them for monitoring. But you're right, they don't tell you if anything actually changed for the participants. That change comes next with outcomes. If you produce those outputs as planned, then you expect to see specific changes in the people you're serving. We're talking about shifts in their knowledge, maybe their skills, their behavior, their status, how they're functioning. This is where you start seeing actual success.
Ah, okay. And the sources mentioned these outcomes happen on a timeline, didn't they? There are short-term ones, maybe 1 to 3 years, and then longer-term outcomes kicking in around years 4 to 6.
Correct. You need that time frame perspective. And then finally, the ultimate goal, impact. If you achieve those short and longer-term outcomes, those benefits for participants, then you can anticipate the really big fundamental change, the shifting organizations or communities or maybe even whole systems. And that typically takes longer. Think 7 to 10 years out.
That structure feels really logical, very rigorous. Seems like it would be incredibly helpful for focusing strategy. But I wonder, where do things usually go wrong? Does laying it out so clearly ever make organizations, too rigid? The real world isn't always a straight line, right?
That's a fair question. Because it looks linear, it looks rigid on paper. But its real value often comes from the conversations it forces you to have up front. It makes planning stronger because everyone has a look at the evidence, the best practices, the assumptions, and it actually helps avoid rigidity later because it's really a hypothesis. It's your theory of change laid out. You use it as a management plan, something you constantly test and adjust based on the data you're getting back about your outputs and, crucially, your outcomes. So it actually helps you pivot smartly, guides your evaluation, strengthens your reports, and makes a much clearer case for why your program deserves investment.
Okay, that makes sense. It's a living document, not just a static plan. Let's make this more concrete then. Let's dive into that My Town Community Clinic example. This clinic was set up because the town had a specific problem. A growing number of uninsured folks were using the hospital ER for basic care, which is, well, expensive and not ideal.
Yeah, this is a great case study for that plan backward, implement forward idea. You absolutely start with the results you want. And like you said, the sources all emphasize that those results, those outcomes, need to be smart, specific, measurable, action-oriented, realistic, and timed.
So what were my town's SMART goals?
They really nail it. Their outcomes were clear. First, establish the clinic as a proper medical home for 500 uninsured patients. Second, achieve a specific, measurable goal, a 25% reduction in uninsured ER visits within 5 years. And third, maintain high patient satisfaction, 90% or more, also for 5 years. Very crisp.
And it wasn't just about patient health outcomes, was it? I noticed their impact goal included something about the clinic's own future.
Absolutely, that's a key point. The ultimate impact was twofold. Yes, a sustained reduction in inappropriate ER use across the whole community. But also, establishing a clinic endowment fund capable of supporting 35% of their operating costs within 10 years. That ties the health mission directly to long-term financial health. Really smart planning.
Okay, achieving that kind of impact, especially the endowment part, requires getting the planned work side of the model right from day one. So what were the key resources or inputs my town identified needing?
They pinpointed 3 critical inputs right at the start. 1, get that official IRS 501c3 nonprofit status, essential. 2, secure the initial funding needed. They budgeted $150,000 for the first year. And 3, find a physical space, ideally donated maybe from the local technical college.
Right, the basics. Legal status, money, and a place to work. And those inputs then fuel the activities.
Exactly. The activities became their action plan. Things like hire the clinic director, do site visits to learn from successful clinics elsewhere, like the Anywhere Free clinics mentioned, run a strong PR campaign to get volunteers and let potential patients know they exist. And crucially, work with the hospital ER staff to set up a solid evaluation plan from the get-go. See how every activity is directly linked to achieving those outcomes, like reducing ER use?
Yeah, you can really see the if-then logic playing out there. If we get the funding and space, then we can hire staff and run campaigns, then we can serve patients and track ER visits. It connects.
That's the power of it.
Now, that basic 5-step model seems pretty clear. But the sources also suggest logic models aren't one-size-fits-all. They're flexible. So let's shift gears a bit and look at the different types of logic models people use. Seems like there are roughly 3 main kinds.
That's right. And you often choose, or maybe blend, types based on what you're trying to emphasize or where your program's main challenge lies. You pick the model that helps you focus on that specific aspect. We can start with the outcomes approach model. This is pretty much what my town used primarily. It really hones in on connecting the resources and activities directly to the results you want. It lays out those outcomes very clearly across the different time frames: short term, 1 to 3 years, longer term, 4 to 6 years, and that final impact, 7–10 years. These are really great for designing your evaluation because they spell out exactly what you need to measure and when.
Okay, that makes sense for tracking progress towards goals. What about the theory approach model? That one sounds a bit more conceptual.
It is. The theory approach model is super important, especially for programs trying to change complex behaviors or tackle really deep-seated problems. It focuses much more on the theory of change itself, the underlying assumptions about why you believe your program will actually work.
So it's less about the what and more about the why.
Exactly. If the standard model asks, what will we do and what will happen? The theory model digs deeper and asks, why do we fundamentally believe this specific intervention will lead to that specific change, given the context?
How does that look different visually? Is it still a line?
Often it's less linear. You might see more boxes representing external factors, maybe arrows showing influences like the economy, political shifts, cultural norms, things outside your direct control, but that definitely affect your program. It forces you to spell out those core assumptions that absolutely must be true for your plan to have a shot at succeeding. Think about my town again. Their theory of change model would have pushed them to clearly state their problem statement. The issue wasn't just uninsured people, it was specifically rising numbers of uninsured male workers aged 40–55 laid off from plant closings who are now driving up ER costs. That specificity matters.
And then the assumptions piece. What did they assume had to be true?
Right. They had to articulate assumptions like, 1, based on evidence from elsewhere they cited, another town providing affordable primary care does actually reduce ER visits. That's a core belief, backed by, hopefully, data. And 2, a crucial local assumption, that my town's known history of extraordinary volunteerism would actually translate into enough medical professionals donating time specifically, citing the medical society's support for members volunteering 20 hours a year to make the clinic sustainable. That why it will work belief is what the theory model really brings to the surface.
I see. That forces a different kind of critical thinking up front. Okay, so we have the outcomes model for tracking results, the theory model for the why. What if my main challenge is just managing the day-to-day, keeping the trains running on time? Is there a model for that?
There is. That's the third type. The activities approach model, sometimes called the applied model. If theory is the why and outcomes is the what success looks like, then the activities model is really the how. It zooms in on the implementation details. Think of it as a very detailed work plan derived from the logic model. It's fantastic for daily program management, tracking tasks, monitoring progress on the ground level.
Got it. So you might even use different types at different stages or for different audiences. Okay, we've seen this work really well for a local project like my town. Let's scale this up considerably now. How does the logic model framework handle something really complex, like global health initiatives? Let's look at the example concerning community health workers, or CHWs, in low and middle income countries, LMICs.
Right, this CHW model is fascinating because it was built specifically to address a huge knowledge gap. How do you actually ensure optimal, sustained performance of CHWs at scale? We're talking about vast, complex environments, poverty, weak infrastructure, diverse cultures. The framework needed to be really robust.
Yeah, we're going from my town tracking 500 patients and a 25% ER reduction to global programs looking at things like overall morbidity, mortality, fertility rates. That's a massive leap in complexity and scale. How does the basic logic model structure even cope?
It copes by adapting, by building in that systemic complexity. The core idea, the theoretical premise of the CHW model is that these health workers don't operate in a vacuum. They're working right at the intersection of two massive overlapping dynamic systems.
Two systems.
Yes, the model states that for CHWs to perform optimally and sustainably, you need high-quality CHW programming itself, obviously. But, and this is crucial, that programming has to be actively supported and reinforced by both high-performing health systems and high-performing community systems. The CHW is the bridge, but the bridge needs strong anchors on both sides.
That makes intuitive sense. The CHW is often that lone link between formal healthcare and the community reality. So what kind of support activities are we talking about on the health system side?
Well, from the health system, you need things like good governance overseeing the CHW program. You need reliable and adequate financing. CHWs need to be paid, supplied, supervised. Service delivery needs to be organized efficiently. There needs to be a capable health workforce managing and supporting the CHWs. And, very importantly, there needs to be systematic gathering and use of information and data related to their work. If any of those systemic supports crumble, the CHW program is likely to struggle no matter how good the individual workers are.
Okay, and what about the community system side? What does that entail?
That's just as vital. Community system support means things like sound local governance of community resources. It means fostering social belonging and cohesion, things like trust, shared identity, community buy-in for the CHW's role, and it also involves the community's ability to mobilize its own resources, maybe volunteers, maybe transport in emergencies, local problem solving. These community-level factors create the enabling environment where the CHW can actually function effectively day to day.
So the model has to account for inputs, activities, and outcomes happening at multiple levels. The individual CHW, the community, the health system.
Exactly, and the evaluation reflects that too. When they look at results, the outputs might be measured at the individual CHW level, things like their knowledge, their skills, their motivation, but also critical direct measures like rates of absenteeism or observed quality of the services they deliver.
Right. Those are direct results of the program's activities focused on the CHW. But the ultimate impacts in this model, they're not about the individual CHW's performance anymore, are they?
No, the impacts here are measured purely at the population level. You're looking for those big shifts in public health indicators. Measurable changes in morbidity rates, mortality rates, fertility rates, and also measures of equity is the program reaching the most vulnerable. It demonstrates the large-scale societal benefit when CHW programs are effective and properly supported at scale. Bringing this back to evaluation just for a moment, when you build a clear logic model, whether it's for my town or for a global CHW program, it naturally helps you frame your evaluation questions.
How so?
Well, it generates two essential types of questions. You get formative questions. These usually focus on the activities and output side of the model. They're designed to help you improve the program as it's running. Are we doing things right? Are we reaching the people we intended?
Okay, mid-course corrections.
Exactly. And then you have summative questions. These focus more on the outcomes and impact side. They're designed to help you prove the program's overall effectiveness, usually for funders, policymakers, or other stakeholders. Did we actually make the difference we set out to make? The logic model provides the framework to ask and answer both kinds of questions.
And that really highlights the enduring value of this tool, doesn't it? Whether you're mapping out that huge global health strategy or launching a local clinic like my town, or even just planning a complex project in your own work, the logic model gives you that clear map. It creates a common language for everyone involved and provides a really rigorous way to lay out and test your thinking.
It really does. But what's fascinating, and maybe a good place to leave things, is that even the designers of that sophisticated CHW logic model admitted a key challenge. They noted that their visual model, that two-dimensional chart, really struggles to capture the full complexity and, crucially, the interdependence of those two big systems, the health system and the community system, that are so vital for CHW success. It's hard to show that dynamic interplay, that feedback loop, in neat boxes and arrows. Oversimplified just so they fit nicely onto a standard linear diagram. So they're definitely worth mulling over as you think about your own theories of change.